Good day, everyone. Today, I would like to present our study on essential oils as therapeutic options for fungal nail infection. The study was carried out by researchers from the Biomedical Science Program, Faculty of Health Sciences UKM, UKM Medical Centre, Faculty of Medicine UKM, and the Institute for Medical Research. Fungal nail infections, or better known as onychomycosis, occur very commonly, especially in the elderly population. Up to 50% of those who are above 70 years of age tend to be infected with fungal nail infection. The main causative fungi for these infections include dermatophyte fungi, yeast such as Candida, molds such as Aspergillus, Fusarium, and many other species. As these fungal nail infections tend to be very chronic and they last for many years, long-term oral or topical antifungal medication is necessary. Antifungal agents such as terbinafine or itraconazole tend to have a good recovery rate, up to 60% of patients recover, but they do have high relapse rates. Therefore, alternative therapeutic options should be sought. Essential oils, especially those that have phenolic components in them, have potent antimicrobial activity with reported low toxicity. Therefore, these essential oils may be an alternative therapeutic option. The objective of the study was to determine the most effective essential oil that can be used as treatment for fungal nail infection. In the first phase, an in vitro evaluation of different types of essential oils was carried out against pathogenic fungal species that typically cause fungal nail infections. In the second phase, an ex vivo evaluation of the essential oil that had the best antifungal activity in the first phase was then carried out. And finally, a clinical evaluation of the essential oil that was most potent and with the broadest antifungal activity was performed. In the in vitro evaluation, a microdilution assay was performed to determine the minimum inhibitory concentration of essential oils against fungal isolates. 4 different essential oils were tested, which were eucalyptus, lemongrass, thyme, and patchouli. Amphotericin B, an antifungal agent, was used as a positive control. The fungi that were tested were Trichophyton rubrum, a dermatophyte fungus, Candida albicans, a yeast, Aspergillus niger, and Fusarium solani, which were both molds. Our results indicated that eucalyptus and lemongrass essential oils showed potent and broad antifungal activity against all the fungal species tested. Therefore, these 2 oils, eucalyptus and lemongrass, were utilized in the next phase of our study. For the ex vivo evaluation, healthy fingernail clippings from volunteers were inoculated with the fungal suspension and incubated for 21 days for the infection to progress, as shown here in the diagram. These infected fingernail clippings were treated daily with an application of essential oil and cultured on appropriate agar media to determine the fungal burden. Eucalyptus essential oil markedly reduced the fungal burden for all of the fungal species tested in the nail clippings, while lemongrass essential oil was less effective as it had no effect on Aspergillus niger infection. Therefore, eucalyptus essential oil at 10% concentration was deemed as the most effective essential oil for fungal nail infection, and eucalyptus oil was thus utilized in the next phase of the experiment. In the clinical evaluation phase, volunteers confirmed to have fungal toenail infection were recruited at Hospital Chancellor Tuanku Mohris. The volunteers were given 20% eucalyptus oil solution and instructed to apply the oil on the infected nail, on the skin surrounding the nail, and underneath the nail for up to 6 months duration. To determine the clinical cure, the nail morphology was noted, while to determine mycological cure, the fungal load in the nail samples was determined. The clinical study results indicated that 70% of the treated nails showed an improvement based on nail morphology, while 11% of nails showed a complete clinical cure where the nail appearance returned to normal. The picture indicates complete cure for sample number 4 and a partial cure for sample number 7. In total, 27 nails were treated with the essential oil. To determine if there was fungal clearance in the treated nails, nail samples were cultured on appropriate media to determine the fungal load. A reduction in fungal load was observed in 55% of nails that were treated, while total fungal clearance was seen in 50% of samples. The table indicates complete clearance of fungus in samples 4 and 7, while in sample number 9, although there was complete fungal clearance, the nail morphology indicated only a partial cure. In 20% of cases, the initial isolated fungus was replaced with other secondary invaders. Our results also indicated that a longer treatment duration was more effective, while nail morphology was a more reliable indicator compared to fungal burden, as the results were inconsistent. The eucalyptus essential oil was more effective against several species of fungi. Therefore, synergistic activity with other oils should be explored in future studies. In conclusion, 20% eucalyptus essential oil is effective in treating toenail infections. With that, I thank you.